and welcome. You're watching Health and Wellness Save a Life. I'm Gargi Rawat. The problem of sudden cardiac death is a major concern all over the world, affecting people of different age groups. When it comes to India, the problem has escalated due to the sudden change in lifestyle and food choices. When medical emergencies like cardiac arrest happen around a person, it's important to be prepared. If you're aware and informed, then you can take steps to revive a person and save his or her life. Worldwide, millions of people die of sudden cardiac arrest every year. This is partly due to limited and sometimes ineffective bystander cardiopulmonary resuscitation. Many adults in cardiac arrest can be revived with intact neurological function if the bystanders provide immediate CPR. It is even more important to learn about CPR if you have a loved one who has a history of cardiac disease, as research reports that the majority of cardiac arrests occur at home. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists to help you understand sudden cardiac death and the role of CPR to revive and save a life. We're now joined by Dr. Arun Chopra, HOD Fortis Escorts, Amritsar, and Dr. Rahul Sawant, Consultant Interventional Cardiologist, Hridaymitracardiaclinic, Pune. Thank you so much, doctors, for joining us on this very, very important topic. And Dr. Chopra, first to you, a competitive lifestyle keeps this generation constantly stressed. Can constant stress cause sudden cardiac death?
Yes, of course, because constant stress is associated with elevation in stress hormones in the body. These stress hormones raise the blood pressure, they can raise the blood sugar, plus often people who are under constant stress have irregular eating and sleeping habits, so they tend to eat more junk food, they tend to eat at irregular times, and they tend to sleep poorly as well. So all these factors are associated with the high blood pressure, high diabetes, increased risk of diabetes, and disturbed lipids or cholesterol levels. And all of these are very significant risk factors for heart disease. So they can not only lead to heart attacks, they can also predispose to sudden cardiac arrest, because especially in males, nearly half the patients who have a heart attack present with sudden cardiac arrest as the first presentation. So sudden cardiac arrest is fairly common, and that's why I think we are seeing a spate of sudden cardiac arrests even.
Right. Now, Dr. Sawant, for us Indians, particular causes of concern in heart disease are an early age of onset, rapid progression, and also high death rate. Why are Indians more prone to heart diseases?
Thank you for having me. Basically, Indians, we are a South Asian race, and by genetic makeup, South Asians, that is Indians, Pakistanis, Bangladesh and Sri Lanka, these countries are at higher risk of developing coronary artery disease. Secondly, as you can see that diabetes is on a significant rise in India. Diabetes capital of the world is India, and the heart disease capital of the world is also India. The diabetes is on the rise, high blood pressure is on the rise, as sir mentioned, the cholesterol is rising, and the reason for all this is bad lifestyle. So eating habits, people in Indian subcontinent have a carbohydrate based diet, so our population eats more of a rice, high sugar content, high fatty content and low protein diet, and that's one of the reasons for increasing sugar levels, rising cholesterol. Second factor I would mention is a poor lifestyle, that is people are not taking any exercise. Most of the population in sedentary lifestyle work, basically IT sector, service sector, they are hardly walking. So they spend most of the day sitting and there is no activity whatsoever. And that is leading to increased risk of coronary artery disease. Other problems are sleeping issues. People are not sleeping and working all throughout night. Then lack of exercise, smoking, all these factors are leading to increased cardiovascular risk.
Right. Dr. Chopra, what are the chances of surviving sudden cardiac arrest?
Chances of surviving sudden cardiac arrest are poor unless a person gets immediate CPR. Even with that, chances are not great. Even though if let's say a person has a sudden cardiac arrest in hospital, nearly 30 to 40% patients would have a return of spontaneous circulation. That means they have a pulse and blood pressure with or without support. But most patients who have an out of hospital sudden cardiac arrest, very few make it actually. The survival rate is not more than 5%, even if these people get basic life support immediately and they are shifted to a hospital. So, though return of spontaneous circulation occurs, discharge from hospital in an alive and healthy condition is less than 5%. So, it's quite poor.
All right, so it's quite poor. Dr. Sawant, as we discussed, survival from sudden cardiac arrest is possible with fast, appropriate medical care. So how soon should CPR be started after cardiac arrest, and also what steps should be followed before starting CPR?
So very good question. So whenever you find that somebody has collapsed, you need to make sure that patient has developed a cardiac arrest. So what happens if somebody collapses? You're going to ask that person, you say, hello, hello, you get up, and if that person doesn't respond, that means there is a problem. Either he has become unconscious or he has had a cardiac arrest. So how do you know that there is a cardiac arrest? So first thing you would do is make sure you are in a safe environment. What it means is, let's say you're in the middle of the road, you're going to move the person away from that busy road, by the side of the road, or if there is a fire, then you're going to try and move the patient away from that fire. So you have to be safe, and the patient or the person has to be safe. Then you're going to feel the pulse of the patient and try and feel the pulse, see if there's an ongoing pulse activity. That means whether the heart is working or not. And second thing you're going to look is if the patient is breathing or not. So if the person is not breathing and there is no palpable pulse, that means patient has developed a cardiac arrest, and obviously he is not responding to your commands. Whenever there is a cardiac arrest, you are supposed to respond immediately, in the sense that you're going to start CPR. Before starting a CPR, if there are any other people around, you're going to ask them to call for medical help. If it's in the hospital, then obviously we call a cardiac arrest team. But let's say if you are in the middle of the road or in the community, you're going to ask another person to ring a paramedic or medical team immediately, and then you are going to start a CPR immediately. So basically there should not be a time lost between starting a CPR and recognition of a cardiac arrest.
All right, we're also joined by Dr. Amit Pendharkar. Dr. Amit, there is a common misconception that heart attack and cardiac arrest are the same things. What is the fact?
Heart attack is a condition in which there is damage to the heart muscle, which is usually caused by blockage in one of the arteries which supply blood to the heart. While cardiac arrest, as the name suggests, it's a condition in which there is a stoppage of the function of the heart stops. Heart attack can cause cardiac arrest, while cardiac arrest can be caused by different factors apart from heart attack, such as it can be caused by what we call as hypoxia, that is low oxygen. Cardiac arrest can also be caused by electrocution, drowning, and cardiac arrest is usually the terminal event before death. So, heart attack, cardiac arrest has multiple reasons, and it's a grave condition. Left untreated, it causes death.
All right, Dr. Chopra, now according to our discussion, cardiopulmonary resuscitation is a life-saving technique, but will CPR always save a life?
No, that is exactly what I was telling you, that whatever is the chance of survival, that is if the person gets CPR. But even if the person gets CPR, that is not a guarantee he will survive. So, for instance, in areas where there is lot of training in bystander CPR, for instance, in USA, in Europe, there is a famous study called Seattle Heart Watch. So there, the survival rates are somewhat better. Even then, they are less than 10%. But elsewhere in the world, CPR leads to survival ultimately in less than 5% cases. That's all.
All right, and we're talking about CPR and the role it plays and how everyone should know it. But Dr. Pendharkar, can you please explain the process of CPR and how it should be done?
CPR, first of all, you have to take care, it involves two processes. One is the cardiac resuscitation, other is the pulmonary resuscitation. So, currently the emphasis is on, we should stress more on the cardiac massage rather than the respiration. The reason being, for initial stages, initial phase after cardiac arrest, there is a sufficient oxygenated blood in the lungs, which will prevent the irreversible damage to the brain. So what we have to do, the patient should be and usually we recommend the supine CPR. The patient should be in the heart surface. Then with the cardiac massage, it has to be done at the rate of 120 per minute. And how it is done? We place both the palms are placed on the sternum, what we call as a breastbone. And what is important is there should be no bend at the elbow joint. And we press it, in others it's done at it should be compressed for 2 to 2.5 inches at the rate of 100 to 120 per minute. If you are doing respiratory things, for example, mouth-to-mouth respiration, the recommended rate is 30 compressions for 2 breaths. And while doing mouth-to-mouth breathing, you pinch the nose and exhale air into the lungs. And what is important is whenever you do cardiac massage, there should be complete relaxation between the compression, because the concept is that we compress the heart, and once we release the pressure, the heart, by recoil, the blood comes into the heart, and when we compress it, it goes into the different organs. And the aim of the cardiac massage is to maintain blood supply to the vital organs such as brain, and so that there is no irreversible damage to it. And what should be the endpoint of the CPR? The endpoint of CPR should be either there should be a return of the spontaneous circulation, or we declare the patient is declared dead.
All right. Well, with that, we'll slip into a short break, but return with more questions for the doctors. Stay with us. Welcome back. You're watching Health and Wellness, Save a Life, where we're talking about the importance of CPR and learning CPR so you can change from a bystander to a lifesaver. Let's go across to our doctors and ask them questions on this. Dr. Sawant, to you, the majority of us don't know the exact technique of CPR, and there's always the fear that they could get involved in any legal proceedings. Is giving CPR legal in India?
Giving a CPR is legal in India, and most of the countries, I don't know any country where it's not legal. So giving a CPR is absolutely essential to save a life. So you would not get into any legal troubles for giving a CPR. So everybody should not worry about it.
All right, so that's important to know when one learns it, that you can step in and help save a life. Dr. Pendharkar, almost every family has at least one person with cardiovascular disease. Tell our viewers how important it is for patient caregivers and relatives as well as family members to learn CPR.
Every person who has got a cardiovascular disease, he or she is at the risk of developing cardiac arrest. So one of the family members, especially the person, at least one of the family members, especially the person who spends maximum time with the patient, should learn CPR, because time is the key in CPR. The earlier we initiate CPR per se does not save life, does not cause the heart to restart, but it prevents the permanent damage to the vital organs such as brain, especially brain. So CPR given promptly and with effectively can make a difference between life and death, and between a residual deficit and without a residual deficit.
Right. Now, Dr. Chopra, what happens if you perform a CPR on someone with a pulse?
So that is absolutely not to be done. Just as Dr. Rahul Sawant was saying, the first thing we do is to check the pulse. After we push the patient into a safe environment, we've looked around, there is no issue. We ask for help and we check for pulse. So everybody who's trained in CPR is taught to feel the carotid pulse, which is in the side of the neck. So this pulse should be felt before initiating CPR, because if we start CPR unnecessarily, then it can lead to irregularity of heart rhythm, and it can lead to injury to the chest wall as well. So effective CPR, as Dr. Amit told you, will cause fracture of ribs. and therefore doing CPR if not necessary is not good.
All right, so that's important to keep in mind regarding the pulse. Now, Dr. Sawant, after surviving cardiac arrest, what is the primary goal of cardiac arrest management?
So what we discussed about is a cardiopulmonary resuscitation or CPR. So basic life support, and after that we need to do an advanced life support. So what it means is when you do a CPR, try to resuscitate the person by doing a cardiac massage and breath supports if possible. Medical or paramedical team will arrive and take over. They will connect the electrodes, ECG electrodes, and see if the patient has got a rhythm. And if whatever that rhythm is, based on that, we will either give a DC shock, electric shock to the person if the patient has got a abnormal electrical activity we call it as ventricular tachycardia or ventricular fibrillation. That means the lower chamber of the heart is running at a very fast rate. We try to salvage the patient, we get the patient to the emergency department or intensive care unit, and then our job is try to assess why did the patient develop a cardiac arrest. As initially it was discussed that cardiac arrest could be due to heart attack. So heart attack is one of the causes of cardiac arrest. There are many causes of cardiac arrest. Just to name a few, if there is a volume loss because of severe diarrhea, vomiting, or blood loss due to any reason like trauma or operation, patient can go into cardiac arrest. Patient can have a blood clot on the lung or a condition called pulmonary embolism, which was commonly seen in COVID situations, that can lead to cardiac arrest. A massive stroke, cerebrovascular accident, then can lead to cardiac arrest. Burns, trauma, injury, number of reasons can lead to cardiac arrest. So it's a job of a medical team to assess the patient and ascertain what is the cause of cardiac arrest. Basic things when the patient comes to us, we will do the ECG of the patient, we'll check their pulse, blood pressure, vital parameters, we'll do arterial blood gas analysis and send the basic blood samples like hemoglobin, cholesterol, sugar level, etc. So we'll do this basic assessment and we'll try to ascertain what is the cause of the cardiac arrest. We'll also try to do chest x-ray and 2D echo of that patient when the patient arrives in emergency department. So cardiac arrest is a massive topic, and what we are trying to teach the population is to realize or recognize the cardiac arrest and start the basic life support CPR. For that, this is the Save a Life initiative, and our aim would be to train as many people or citizens of India to understand and give a CPR to anybody who has a cardiac arrest. So I think we should target frontline people like police force, teachers, regular workers who are working in the community. They should be all targeted. Gym goers, all they should be targeted and they should be trained to do CPR. I think that will be a huge help in saving lives.
Right, it's clearly something that needs more awareness and more emphasis in the country. Dr. Pendharkar, what are the after effects of cardiac arrest? What precautions should a person take after discharge?
Cardiac arrest, even the person survives from a cardiac arrest, there is a high probability that he or she may be left with a residual deficit in vital organs such as brain, kidney, liver. So that is the issue with it, and these residual deficits, they may result in a prolonged hospitalization also. And whenever a patient is discharged, what we have to remember is any person who develops a cardiac arrest, there is a possibility that that person may again develop it. So all the precautions have to be taken. We have to look at what was the reason for cardiac arrest, and it should be properly treated. And the precautions such as as I mentioned earlier, at least one of the family members should learn CPR. And all the precautions what we advise we give to the patients, such as lifestyle changes, proper medications, and proper follow-up, all these things have to be done religiously. Because even if one survives a cardiac arrest, we have to remember that the next time he or she develops cardiac arrest, he may not survive from it.
All right, that's important to keep in mind. And Dr. Chopra, finally, what is the best diet for heart patients?
The best diet for heart patients is the healthy diet which is homemade. So our diet typically is very rich in carbohydrate and we take less of proteins. So the Indian diet ideally should include more of proteins, some less of carbohydrates. The carbohydrates which we take should be complex. like vegetables, fruits, rather than simple carbohydrates. And we should take healthy fats, avoid fried foods, avoid snacking, and avoid smoking and excess of alcohol. So all these things are part of a healthy diet.
All right, Dr. Sawant, if you could tell us, we've been talking about, healthy lifestyles and exercising, but what exercises should one avoid if they have heart problems?
I think the best exercise most of the cardiologists would recommend is walking more than 30 minutes a day. So walking is the best exercise, I would say. If somebody has developed a heart disease, I would recommend them to stay away from strenuous exercise. So what is strenuous exercise? I would say running a marathon or doing a heavy weightlifting in the gym, or doing heavy sports like mountaineering, trekking, where there is a significant amount of energy is required. Those kind of exercises I think they should avoid. They should also avoid deep water diving like scuba diving. These kind of exercises are going to put more stress on their heart, and that is going to increase the chances of further heart attacks, I would say, and it's not going to be beneficial for that person. People have got this kind of misunderstanding that doing strenuous exercise is going to help them. It's not. Actually, doing a 30 to 60 minute brisk walk is the best exercise for anybody's heart.
All right. Well, thank you so much, doctors, for joining us today, talking about all these issues and answering all our questions. And clearly, it's very important for people to learn about CPR. It could help save a life. Thank you all for watching at home. Goodbye.